Today will be talking about arthritis and Ayurvedic treatment in arthritis. Now, arthritis in Ayurveda, it is known as Sandhivata, and it is one of the disorders. Like Sandhivata can be compared or correlated to osteoarthritis in modern science, where the degeneration process of the joints takes place, and there are certain risk factors involved that we are going to see in the following lecture. Now, arthritis, as I've mentioned, that it is known as Sandhivata in Ayurveda, and it is a degenerative joint disorder that is characterized by pain, inflammation, and stiffness in the joints. This condition affects the joints, leading to discomfort, reduced mobility, and a significant impact on the quality of life of that individual. Sandhivata combines two Sanskrit words, Sandhi and Vata. Sandhi means joint and Vata means the Vata dosha. And Vata dosha, which is one of the three fundamental bodily bioenergies, that is considered as one of the most important bioenergies in Ayurveda, that is responsible for movement and activity. Now, in Ayurveda, health is maintained by the balance of these three doshas, the Vata, Pitta and Kapha. Sandhivata is primarily associated with the aggravation of Vata dosha, which governs movement, dryness, coldness in the body. When Vata becomes imbalanced, it can lead to deterioration of these joint tissues, resulting in the symptoms of arthritis or Sandhivata. First, we will have to understand what is this Vata dosha. What are the characteristics of the Vata? Vata is characterized by qualities such as dryness, lightness, coldness, roughness. It is very subtle and also it's very mobile. Vata is responsible for all types of movements in the body, including the circulation of the blood, movement of nutrients and also waste, and transmission of these nerve impulses, the sensory nerves which reaches the brain, and then from the brain motor impulse comes back. The second, then aggravation of the Vata, this Sandhivata will only happen when there is this aggravation of Vata. There are several factors that can lead to this aggravation of Vata dosha, and it contributes in this development in this of Sandhivata. First, the diet. Now, consumption of dry, cold, light foods will lead to the aggravation of Vata dosha. Excessive physical activity, irregular daily routines, and insufficient rest, keeping awake at night, these all kind of lifestyle activities will aggravate the Vata dosha. Weather also, cold and dry climates, they can exacerbate Vata dosha. Age, like as we as an individual age, Vata naturally increases, making older adults more susceptible to this Vata related disorders like arthritis. Stress, anxiety and fear can also disturb Vata balance. So after understanding the characteristics of Vata, what leads to this? What is the pathogenesis of Sandhivata? When the Vata dosha is aggravated, it tends to accumulate in the joints, causing dryness and reducing the synovial fluid, which lubricates the joints. And this dryness leads to the degeneration of the cartilage and also subsequent symptoms of arthritis will be seen, such as pain. Now vata's mobile and rough qualities causes friction and discomfort in the pain, in the joints, that causes pain. Stiffness, the drying nature of the vata leads to the stiffness, and particularly after the period of inactivity, like if you are sitting for a quite a long period of time and try to get up, your joints will become stiff. Swelling, now vata's coldness can lead to a poor circulation and accumulation of the fluids in the joints, causing swelling. Reduced mobility, like joint degeneration and pain, they restrict the movement of the joints, leading to the reduced mobility of that individual. Now looking to all these symptoms, what can be the Ayurvedic approach to Sandhivata? But before that, we'll have to diagnose the disease. Now Ayurvedic diagnosis involves a comprehensive evaluation of the patient's history, physical examination, and assessment of these dosha imbalances. Now we as a practitioner, we use pulse diagnosis, nadi pariksha. We use tongue examination, jihva pariksha, and observation of physical symptoms to determine the extent of the vata aggravation. The treatment principles that we can include in the while treating this Ayurvedic Sandhivata, our primary aim of the Ayurvedic treatment for Sandhivata is to pacify the aggravated vata dosha, restore balance, and improve joint health. The holistic approach in doing so will involve, first is diet. We'll have to emphasize a vata pacifying diet that is warm, moist, and nourishing in nature. Foods such as cooked vegetables, whole grains, ghee, and warm spices are recommended. We'll have to also ask to avoid food that are cold in nature, dry, and processed food. Then there are some herbal remedies, like using specific herbs and formulations that have anti-inflammatory and analgesic properties. Very commonly used herbs in Sandhivata is, one of the herbs is ashwagandha, that is very well known for its anti-inflammatory and rejuvenating properties. Then Dashmula is the root of 10 herbs that are those are also known for their anti-inflammatory properties. Then Gugul is Commiphora mucul, effective in reducing the inflammation and the pain in the joints. Shallaki, Boswellia serrata, it provides relief from joint pain and swelling. And there are some panchakarma therapies that also can be involved in order to treat this arthritic condition. Now detoxification and purification process, that is panchakarma, also helps remove the toxins and balance the doshas. The key therapies that can be used in the treatment of arthritis is Abhyanga. First is Abhyanga, oil massage, using warm medicated oil to nourish and lubricate the joints. Second is steam therapy, Svedana, to improve the circulation and reduce the stiffness in the joints. Third is Basti, the medicated enema. Basti is a very highly effective treatment in order to balance the vata dosha and also alleviate the symptoms of arthritis. Fourth is that we will require lifestyle modification from that patient. We will have to encourage the patient to have a regular daily routine, adequate rest, and gentle exercises like yoga to maintain joint flexibility and overall well-being. Stress management also plays a very important role in the treatment of arthritis. Practices such as meditation, pranayama that is breathing exercise, and mindfulness reduces the stress and anxiety, and which can also alleviate the vata dosha. We also require an integrative approach. Now, integrative approach will combine modern medical treatment with Ayurvedic principle that can offer and comprehensive management of arthritis. While modern medicines provide immediate relief from acute symptoms through the medication and physical therapy, Ayurveda addresses the root cause by balancing the doshas and promoting long-term joint health. So when we use this integrative approach, we can get a good relief, good treatment in this the treatment of the arthritis. After doing the treatment of arthritis, we will also require a rejuvenation treatment that is called as Rasayan. Now these rejuvenation therapies aims to strengthen and rejuvenate the body, restoring the health and vitality. There are therapies that focus on enhancing the quality of the tissues and improving the overall immunity and the well-being of the body. Some of the Rasayan herbs and formulations include, first is the ashwagandha, very well known for its adaptogenic properties and also rejuvenating properties. It helps in reducing the stress and overall promoting the vitality of the body. Second is amalaki, that is officinalis, Ambelica officinalis. Amalki or amla, Indian gooseberry, it is a rich source of vitamin C and antioxidant. It supports tissue regeneration and boosts immunity. Third is shatavari, that is asparagus racemosus. It nourishes and rejuvenates the tissues, particularly effective for balancing the vata dosha and the pitta dosha. Then we can also use guduchi, we can also use tagar. These are all type of adaptogens that will increase the overall immunity of the body. Then diet and nutrition plays a very important role, like a balanced diet that will include nutrient dense food. It supports tissue health and rejuvenation. We'll have to emphasize on the food that is easily digestible and provide the essential nutrients for the joint health. Lifestyle and daily routine, as I've already mentioned, that you'll have to maintain a good lifestyle, adapting a daily routine, the dinacharya, that supports doshic balance and also promotes the overall well-being. It will include a regular sleep pattern, balanced activity levels, and also mindful practices. We'll have to incorporate practices for like yoga and meditation to enhance the physical and the mental resilience of the body. Thank you.